Imagine if these two people were alive today. How happy would their families be that their daughters were still part of the family? Both Stephanie and Whitney died from an overdose of legal drugs, and both were preventable deaths. In fact, this story is sadly all too common. The number of illegal drug overdoses, as shown on this graph from the US Centers for Disease Control, is rising. During the COVID pandemic in Canada, there were over 1,600 deaths in 3 months. These deaths are not just numbers. There are parents who have lost children and children who have lost parents, resulting in broken families. In contrast, some drugs that are harmful to your health are legal, such as alcohol, cigarettes, and even marijuana. Society lets people choose if they want to use them. If they have an addiction, they are able to get medical attention to overcome their substance use disorder. When drugs are illegal, people have to use them in isolation, and over time they lose their social connections. Dr. Bruce Alexander, professor of psychology at SFU, showed that addiction to drugs occurs when there is social isolation and poor living conditions. Essentially, users connect with the drugs, not with other people. If they accidentally overdose, no one is around to help them to get medical attention by calling 911. In Canada, simple possession of drugs can land you in jail, adding a further barrier to maintaining social connection. What if the possession of these drugs were not illegal, but were decriminalized? The decriminalization of drugs such as cocaine, heroin, and other opioids is needed to save lives due to overdose. This would be a benefit to society because many people are incarcerated for the simple act of drug possession, even if they have no intent to distribute drugs. These are people who have fallen on hard times, have mental illness, or are marginalized. They could have difficulty finding employment. Even B.I., a K-pop star from the group Icon, was forced to stop performing because of drug possession allegations. In fact, Brian Larkin, the president of the Canadian Association of Chiefs of Police, Kennedy Stewart, mayor of Vancouver, and health expert Donald McPherson of the Canadian Drug Policy Coalition all agreed that decriminalization will reduce drug overdoses and save lives. An example we can look towards is Portugal, which decriminalized drug possession in 2001. After decriminalization, overdose deaths decreased by over 80%, incarceration for drug offenses decreased by over 40%, and furthermore, the rate of HIV infections from using dirty needles decreased from 52% to 6%. In addition, the use of illegal drugs like marijuana remains lower in Portugal than most other European countries, such as Germany, France, and the UK. If illegal drugs are decriminalized, maybe people who are addicted can get the medical care and the societal support that they need, just like we do for people who are alcoholic or addicted to nicotine. If drug users are not treated like criminals, but like patients who have medical problems, they could get the help that they need. This would lead to a more just, caring, and safer society for us all.